call to order our meeting of Tuesday, August 3rd, 2021. Roll call, please.
Gurecki, Washington, Berkoff,
Here.
Weiss,
Here.
Middleton,
Here.
Hopkins,
Here.
Westerhoff.
Here. Please stand for the pledge. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. All right. First on the agenda, Dr. Arnold, the presentation of the 2021-22 Return to School Plan.
All right. Share my screen here. Okay, can everybody see that? Okay, all right, so good evening, everyone. Nice to see everyone. We're here to talk about how we learned during a pandemic for the third year in a row. And we're certainly all looking forward to the end of this. It was interesting going through our motto, our vision. We do a lot with our district strategic plan. We put a lot of thought into that 2.5 years ago. And I always like to start meetings like this with a focus on what we're here to do. And we really are here and make decisions by empowering each student to develop a love of learning and in an evolving global society. I'm more than 6 feet away from anybody that's not vaccinated, so I'm gonna take off my mask so people can hear me. Our motto is to inspire, engage, and innovate. Some key things from our vision. We do really focus on perseverance for our students and building resiliency for them. I think we all can agree that as far as community, we want to see that in our learners, a growth mindset. We're very focused on their social, emotional well-being, and it has been a focus throughout the pandemic. I won't go through all the different aspects of our vision, but one thing we are is very collaborative. So before I get into the details of my presentation, we have Kyle Jacobson here. He is the president of our teachers union and wanted to start off with a comment. So Kyle.
Yeah, good evening. Thanks. I know we've worked together. We've been communicating with all of our teachers, all the union members, knowing what's going on. And the only consistent is change. We saw how things are going back and forth, looking at what's been recommended, and for abundance of safety, looks like our best bet would be to mandate use of mask until we get our actual numbers back in for the shield, et cetera, using our own data, and we can gradually reduce the use of masks, those who are not are vaccinated, and then have it a recommended type of mask use. I know that's leaves things kind of fuzzy. With middle school, we have age groups currently that are able to get vaccinated that may not be. I know the state has certain requirements on what we need to do for quarantine, et cetera. Our younger kids are different. We get that. So I know that abundance of safety for our students, our staff, our union members, and all of our extenuating family members that we don't know what's going on at the house. That's where I think we're going to go with the direction of Dr. Arnold. We've been talking, it's been nonstop since this first happened. So it's going to the third year. So if you have any questions or anything like that, you can reach out to me. I'll gladly fill it in.
And thank you, Kyle. And I think the reason it's important to talk about this way is that none of these decisions are maybe exactly what we envisioned even a month ago. When we were planning with the union back at the beginning of the summer, I'd say the end of June, this kind of conversation wasn't on the radar. And I'm going to show some charts tonight that will give some indication of why we've made these decisions. And I think it's a good time to also remind, we know we have a lot of parents here who want to talk, and everybody will have a chance. We thought it was best to present the plan, give you something to chew on, give all the parents, anybody who wants to speak, a chance to speak, give your feedback, your reaction, your thoughts and ideas, and then the board will discuss that, and then the board will make a decision. So what I'm presenting is not final. It's just a recommendation of a lot of hard work over a long time. I do want to note, I thought I was done with masks back in the end of June. In February, I got my vaccination, thought that was my ticket. We were set to have no one who is vaccinated have to wear a mask when it came back to school. Things changed over the summer. I'm not happy about it. I don't want to be here, don't want to be having this meeting right now, but believe it's important and essential for our students. So with that tone, just so everybody knows, this is not something that any of us are celebrating or excited to be doing right now. So moving on, our values will be there for people to read. This is nothing new. Here's how we've considered our planning going throughout. First of all, safe and effective in-person learning is our priority. 1 year ago, we were all arguing about how do we come to school? Do we go in person, remote, hybrid? Let's celebrate for a second that we are 100% committed to a full year of in-person learning all day. That we are not looking at any reduced day. Remote learning is not an option. So I think there's a big celebration there because we know students learn better in person. We also know that through our planning, we have multiple levels of mitigation strategies already in place from last year and the year before. We are implementing, I'm recommending that we implement at least one, and looking at 2 new mitigation strategies with this new school year. We'll talk about that more in a minute. We also, in our considerations, know that vaccinations are available for ages 12 and up. We know that the trend for the COVID Delta variant is moving in the wrong direction. That has been the bane of our existence during the month of July. I don't know when I first heard about the Delta variant, but I can tell you the end of June, it wasn't something that we were worried about, and the data was supporting that. The data does not support that anymore, unfortunately. From the beginning of this, we have followed CDC, IDPH, and Will County Health Department guidance. They have given us updates that this ball really got rolling on July 9th. Within 2 weeks of July 9th, I was ready with a plan. We were ready to go. And then things got worse. And the trends continued to go in the wrong direction. So we've gone slow to really rethink our plans. And what you see tonight is not where we started a month ago. How do we make decisions? For those of you who may be new to the process, last year we used multiple metrics to determine the safest, most effective learning models. I've got an image I'll show you in a minute to do a quick recap of last year and how we followed the numbers when we made decisions about the learning model. We do value our school-based metrics primarily. We pay attention to community metrics. When I say community metrics, we break that out by zip code, Homer Glen and Lockport, and by the county. The farther you get away from our classrooms, the less of an influence is on our decisions. So what we really care about are how many positive cases we have in our classrooms, students and staff. That's how we make decisions. It does matter what's going on in Lockport and Homer Glen. It does matter what's going on in the county, but we know that we can do some things that are a little bit safer in the schools that keep us in person longer. We don't want to quarantine kids. So we really make decisions based on those school classroom level metrics. This slide really shows, it's a recap of last year. It's the same slide I used last year when we were looking to go into full day in person. I'm not going to go through it, but you can see we started the year off remote. We went hybrid for a short time. Things spiked. We went remote all the way October 16th to January 18th. As we saw numbers coming down, we went to hybrid once vaccinations were in place for staff. Early April, I don't remember the date, we went to full in-person by choice. We still had the remote option all year last year. According to ISB, that is not an option moving forward anymore. So moving forward, how will we make decisions? We're going to do it differently this year in that we'll still follow the data, but we'll be using it not to decide if we're going to remote or in person or hybrid. We're committed to in person. We'll be using the metrics to decide which levels of the different mitigation strategies we need to have in place. And I have a chart for that too. The metrics will be reviewed every 2 weeks. So we see this as a very fluid situation. I anticipate frustration. I can see a time when we're going to say the metrics are looking really good. We're going to lower the requirement for masks. And you could predict that there's a chance that 2, 4 weeks, 6 weeks later, it starts going the wrong direction again, and we have to put the mask back on. That's the way we follow the science. It's the best we can do. School-based metrics will be the focus, like I said, but we will be paying attention to community-based metrics as well. For those of you in the audience, if you don't have a device, you're not able to see this, so you might be a little frustrated. I wonder, we're used to everybody having a device in our district, and you don't. And yeah, I don't know if we can hook up to that easily. Where's Bill?
Next door.
If Bill,
I
I'll
can
give,
hook up to
I'll
those
give you a
ones.
choice. If you want it, what I'm
Yeah,
showing
we
is
just need one
important.
person to.
If you turn on the media, I can plug in.
Can you
AirPlay.
project?
Is it one of these
Bill, if
remotes?
you could get that going, and the other option, let's give it a second, because I think this is important enough for everybody to see, and
Yeah.
the people in the other room, oddly enough, can see this, and you can't.
This one is this one. Yeah, once you turn it on, I can get the code. It just needs to be on.
Is it plugged in?
Recording in progress.
While they're doing that, if you are very interested in what I'm, oh, can you, are you pulling it up? Okay. If you can look on your phones, that would be another way to do it. If you want to see and you can't see and you don't have a phone, feel free to go next door. You can watch it there and then come back. I really don't want to keep you from viewing this. I do apologize. It's just turned on. Okay.
Give it-
So for the mitigation strategies, what we have here are the different layers, starting with at the bottom, health department, quarantine, and these are really, to some extent, layered in what at the bottom we would take away last. So at the top are the first things we'd look to mitigate or to level out. Near the bottom are the most basic mitigation strategies. So the first lowest level, that row is health department quarantining. We don't have any say over that. Whoops. Second level is encouraging sick students and staff to stay home. So that's a practice we'll have going forward. I don't see that we get to a point where we tell sick people to come to work or school. So that's already in place, has been in place, and will stay in place. The cleaning and disinfection strategies that we put in place last year are maintained. So we will continue to do the same thing we did previously. There is not a view of that until whatever it would take for the pandemic to be over. We will at some point in the future look at reducing those, but those would be one of the last things we take away. Ventilation and air purification, we were pleased with what we had last year, but as we talk about going with fewer and fewer masks, we are currently looking at bringing in some models of in-room air purifiers. It's a whole nother level of safety. It's a big financial commitment, but as we look at ways to reduce mask use, we want to increase the air purification. So we are currently getting quotes and looking into that. Can't promise they'd be here by the first day or that we will do it, but we're seriously looking at that. I think that also shows our commitment that we aren't just here to try to mask people. We want to see our students learning as soon as possible without masks. Moving up the scale, hand and respiratory hygiene. We're not going to ever tell kids to stop washing their hands or coughing into their arm, but we do put some extra measures in there that at some point would go away and we'd be back to a normal hand washing routine. But we're keeping our routines that we had last year in place. Promoting vaccinations, once again, that's it kind of up that at some point we'll be over a threshold and we won't have to talk about that anymore. Testing is a new one that we'll talk about tonight. I've got that in the presentation. We did not do any testing at school last year. The Shield test was not available for us at that time. It is now, and I'll talk about that in a minute. Physical distancing, that's a mitigation strategy that, like I said, you can see where depending on how bad the numbers are, we can be closer to each other or farther apart from each other as a mitigation strategy. We'll talk about that in a minute. Masking, and then how we deliver instruction. So obviously last year, the next line, shows a snapshot of what we were doing in February 2021. And I'm just highlighting that so that you can see we were either hybrid or full remote. Students had a choice, or their parents had a choice. 100% masked. The physical distancing, if you're in school, was 6 foot, and they were eating lunch at home. We didn't even have lunch at school at that point. If you look at what was different starting April through June, how we ended the year, we did some things different. These are a change in mitigation strategies. So obviously we gave all students the full day in-person option. Some students stayed on remote by choice, but we gave them that option for a full day in person. If you look at the next yellow box down, we reduced the physical distance. Numbers were getting better. We knew to come back in school, we had to reduce that distance. So based on CDC, IDPH, Will County Health Department guidelines, we were able to go down to 3 to 6 feet. And we had to have lunch in classrooms because for lunch, there is still a 6 foot requirement. And then promoting vaccinations, that came along at some point. Vaccinations became available to 12 years and up. Compare that column to the next one, where we're looking to start the year. You see 6 boxes that are colored yellow. So let me talk about what these mitigation strategies are doing, and keep looking at where we were at the end of the year and where we're going now. Delivery of instruction. We've gone from a full remote option to everybody in person all day. So that's creating potential for more spread, right? That's kind of going down a step in safety, if you look at it that way. When you look at masking, all last year we had 100% required masks. We are proposing to begin the year, the first 3 weeks, the same way. Everybody wear a mask. I'll talk about how we get out of that in a minute. Physical distance, this is a game changer. And so we've got to get other safety measures in place so that we can have students eat in the lunchroom. And that is a change in the guidance. We are now allowed to have students be 3 feet. They could be less. We're maintaining 3 foot distance in the lunchroom, but by not having to maintain 6 foot, we can get more students in the lunchroom, about half per grade level at K-5, which makes lunch a game changer for us. As things continue to get better, you can see that we can continue to look at that and get more students in the lunchroom, but we're going to go slow. We're not just going to leap into this stuff. Another safety measure that was not in place that we talked about is shield testing. I'll give you some more details about that in a minute. No other changes. The ventilation/air purification, like I mentioned, we are considering an increase in that safety measure. So as we let up on some things, a little bit more risky, we're upping the ante in some safety measures, okay? Trying to keep that nice, steady balance. And then we don't control the the quarantine process, but that has come down a little bit. I will note, you can take this how you want it, but this is straight from the guidance. If you're wearing a mask and you're asymptomatic, there's a better chance of your son or daughter not being quarantined for a close contact. If they're not wearing a mask, there's a very good chance that if there's a close contact, they're probably going to be quarantined. So our priority in District 92 is keeping every student in school every day. We don't want to quarantine anyone. So we're asking for help to make it a safe process. Wear the mask, less chance of getting quarantined, and then we'll keep working on this together. We really want this to work. We have no discretion over quarantines. It comes from the county health department. Our nurses don't make those calls. They're instruments of the county health department. Okay, this is where the rubber meets the road. I developed this chart looking at our mitigation strategies and overlaying those with the CDC's 4 categories. They have a low category, a moderate, substantial, and high. Depending on whether you're looking at case count per 100,000 or positivity rates, there's either a percentage or a number in there. But for discussion purposes, this is the way we are looking at implementing things. And this is as transparent as we can be. So let's look at where we all want to be, and that's in the low category. If we're in the low category, the blue, that means transmission rates are great. We're really happy with what we're seeing in our schools. Things are rocking and rolling. People are safe. Look at what we're recommending. In-person full day for everything. That's a given. Masks, recommended. Not required, recommended. Saliva testing, we haven't talked about that yet. It's all opt-out. It's voluntary. If you don't want your kid to be tested for it, it helps us detect sooner. So even if you're asymptomatic, if we have the testing in place, it catches it 2 days before you get symptoms. So those 2 days, the kids would have been walking around spreading. They don't, because we catch it, they are asymptomatic, and we can quarantine them because they are positive for the virus, and it doesn't get spread and our numbers stay low. Okay, that's why it's important, but it's opt out. We will not force any student or staff to test. Physical distancing, you can see, you can read down the list. That's the best we can do until this is over. So if you're upset about masks, don't want your son or daughter to wear them, I get it. There's an option. Help us get to low and stay in low, and we're there. We're just trying to make smart decisions based on what's really happening in our schools. If things get worse, the numbers aren't as good, look at the progression. We're taking every mitigation strategy, being very thoughtful about it. What's the next thing we do if the numbers creep up? If that happens, we stay in person. We're not going to, across the board, we're staying in person full day. Masks then become required for non-vaccinated. Everything else is the same. It's the only difference. If it gets worse, go to substantial, that orange column. Still in person, still same masking. Now we're looking at, instead of doing something different for the masking, probably going to the cafeteria and saying we need to go back to eating in classrooms, not having kids eating with masks off and getting more than 3 feet away, and let's maintain that 6-foot distance in those areas to the extent possible. Our classrooms won't be set up for that, but we'll be as close as we can. Worst case scenario, where none of us want to be, is in that high. And that's our most restrictive. That means the numbers are really bad. We've got a lot of spread and a lot of people are getting sick. And in that case, it's back to universal masking, which none of us want to be at. Still an opt-out for testing, still 6 feet. You can see it there. This plan is fluid, but that's our best effort to create a very responsive plan for making decisions based on what our numbers in our schools say. I don't know a better way to do it. We can all disagree on, is it real, or should we listen to the CDC or not, and all those things. I'm not going to argue that. We're just trying to make a functional plan that gets us into a school year learning. So I think I've talked about this slide. It's a little bit repetitive, but currently what we know is, and I'll show you in a minute, the metrics aren't trending where we want to. The problem is I don't have school-based metrics to make decisions on because students aren't in school. Hence the reason I'm recommending we start safe. We start with universal, go 3 weeks, see what our numbers are, and then see where we're at. Currently, this is off of the IDPH website as of today. This is the most lagging website. You can see that this is week 29 of their count, so it's about a week old at this point. I think there's cause for alarm when you see youth cases where they are, new cases where they are. None of us want to see that go up. We want to see it go down. I'd like to see that turn around tomorrow.
You got a point there.
No, this is no.
There's a public comment time.
Yeah, thank you.
If you look at the next one, this is their case per 100,000 mark. You can see, if I told you before, in June, we were liking our plans, and then things looked really good. July came and things started changing. None of us would probably like the way that trend line is turning back up. That's the case. That's Will County. That's not our zip code. Once again, we like that this is below, for positivity rate, below that 8% goal, but look at where it's going. It's telling us going the same direction. We don't like that. Let's look at our county data, or I'm sorry, this is our zip code data. So this is Lockport, Homer Glen specific zip code, our 7-day rolling average. If you look that up yourself, yesterday, that line that's almost at 5% is 4.66. Anybody want to take a guess on where it's going to be tomorrow? The next one, we're already there for our cases per 100,000, same group, Lockport, Homer Glen zip codes. We're already in that middle yellow range where we don't want to be. We are the solid line. So if you look at that dotted and dash line, that's the county, I think, the region, and Illinois. So I'm not looking at those. I'm just looking at that solid line. Those are our 2 zip codes. So we're better than Illinois, and we're better than the region, but we're still in the yellow. We don't want to be going that direction. We want to be in the green. So what we've developed this around is students benefit from in-person learning. Our only focus is safely returning to in-person instruction. That's all we care about, safely. And when we say safe, we mean emotionally safe. We mean physically safe for our students and staff. We are looking at mask wearing and shield testing being implemented to maintain the continuity of in-person learning for students. We see those as 2 big levers right now to help us keep kids in school safely without getting sick. And then just to remind everybody, we don't have another option. You can't opt out of full day. The only way we provide that instruction is under a quarantine. So mask requirements that are being proposed tonight. This is from the CDC and IDPH and Will County Health Department. The universal masking, that means that it's required indoors, not outside. And we're recommending that we start the school year for 3 weeks like that, see where the data goes from there. And then, like I said, starting September 8th, we'll review that data every 2 weeks. If any of you followed the metrics last year, every week we gave you exactly what our numbers were. We never fudged it. We told you exactly what our positive number of students were, positive number of staff, how many were quarantined every week. It was always there for the public. We're going to do the same thing. So this isn't any funny numbers game or anything like that. According to the CDC and all the higher ups, you still have to have masks on school buses because they took away that 50-person limit on school buses. So at the end of last year, you can only have 50 students. Now they said fill the buses up, you got to run the routes. But in doing that, they are still requiring the masks on school buses because you do have a lot of students packed into a relatively small space. Saliva testing, let's talk about it. The Shield saliva test was developed last year to keep at a university to keep those students in school safe and to keep the school open. That's why they developed it. That now has been adopted by the state. It's available. But the point I made earlier, it does catch positive asymptomatic cases earlier before you even know you're sick. It catches it. If we test on, we're only testing once a week. We have to test on that right day. And that results in less spread throughout the school. That's our goal. We don't want this to spread. Testing will be provided on a voluntary, optional basis for students and staff. We will use an opt-out form. If the board approves this, that form will go out to every parent, probably tomorrow or the next day. And we just ask that you fill it out. Tell us you don't want your student tested. We'll put them on the list to not be tested. No problem. It is a problem because if we don't have good test data, then we don't know, we're not catching all the pieces. So it is a problem, but we aren't going to treat your child differently because of it, of course. Continued Shield saliva testing. Testing consists, in case you don't know, of spitting into a small vial. I've done it before. It takes about 2 to 3 minutes to complete. I've never seen a kindergartner do it. It's something I guess we could all get used to, but helps keep us safe. It's not painful. It's not a swab in the nose, but if anything, it's kind of silly, spitting into a vial, but it keeps us safe. Test results will be available 24 hours afterwards. We use a third-party vendor. We don't administer any of this. Another company comes in, they line the kids up, they do the test, they take all the vials, goes off to a lab somewhere, 24 hours, the results are available. If a parent chooses, they can have a parent portal, just like everything else today on the web. You can have your own secured portal, check your results. You'll be notified immediately if it's positive. I think there's actually a different process. If it's positive, you get an alert. But if you just want to check the results, you can go on and check at your leisure. Just to be clear, the testing is provided through federal taxpayer funds. There is no cost, no direct cost to District 92. Our employees aren't administering it. And no, we don't get any compensation. Board members, superintendent, there's no money involved in this for schools at all, but it is paid by federal taxpayer funds for the test. So just to recap, that was one mitigation effort. Physical distancing, just to be clear with everybody, our plan is to have 3 feet distance maintained to the extent possible. We do think we can do that in classrooms, and in other areas we're not as concerned. There are no more room capacity limits like there were at the end of the year last year. I think it was a 50-person limit, and the capacity limits for school buses have been removed. Contact tracing, the process is the same. We are an arm of the Will County Health Department. Our nurses don't quarantine technically. The health department does. If you want to tell one of our nurses you can't quarantine me, they'll tell you, okay, you're right. And then we'll call the health department. They'll quarantine you. It just speeds up the process. I do want to emphasize this next slide. The guidance is still coming out. So remember those hard to read charts? They're called exclusionary guidance from IDPH about how to deal with positive and quarantining and all that. There's an updated one. So I'm not sharing the old one because we were told as of today by the county health department that a new one is coming out any day. We've been hearing that for about 2 weeks now, but we are still being told a new one is coming out. So there will be a new chart. They're typically a little bit hard to read, but we have posted that on the web, and that's our guidance. But those 2 bullets do emphasize the gist of it, that if a student's wearing a mask, you could have a situation where students are in a group. One student is positive, so they do the contact tracing. If this student is not wearing a mask and this student sitting the same distance is wearing a mask, by these guidelines, the county would quarantine the one without a mask and not the one with a mask. So I'm not saying this to be heavy-handed. I'm saying it as a dad. If you don't want your kids coming home, consider putting a mask on them. They're going to be less likely to get quarantined. We're going to put something new in place this year. Our nurses got yelled at a lot. They had a lot of things said to them that you wouldn't want said to your spouses, daughters. We're not going to do it this year. If you're upset that your son or daughter is positive or quarantined, we're sorry. They are directed this year to give my office number to you, and then you can call me and you can take a shot at yelling at me. But we're not going to subject our principals, our teachers, and our nurses to being, they were in tears. It's unexcusable. It's not their fault that someone got quarantined or that they got sent home because they were positive. So it needs to stop, and I'll take it. So in those situations, don't be surprised. Hopefully it doesn't happen. But if you're upset, please take the number that they give you. It'll be my number. I'll call you as soon as I can. We'll have a go at it. Okay, next steps. If the board approves this tonight, there's still public comment and discussion to be had. I'd like to schedule 2 noon-hour meetings. I've never done a noon-hour meeting. We almost did some at the beginning of the summer. So we're going to do a lunch meeting. And it'll be recorded. So if you miss it, you'll still get the information. But we'll do one for staff this week, and then the next day, one for parents. That's kind of the typical pattern we follow. I'm looking forward to getting back into that kind of dialogue with everybody. And then the big goal that we have is August 18th. We're looking to welcome students back with smiles, behind a mask for the 2021-22 school year. We do look at this optimistically as being a year where things get better as we go, not like last year where they got a little worse. We're really hoping that things continually get better throughout the year. And that's my presentation.
Excellent.
For board discussion, yeah.
Thank you.
Or no, public
No.
comment.
Yeah.
Sorry.
All right.
Let me minimize real quick.
Oh, yeah. Okay.
This.
So a designated portion of the school board meeting is set aside to hear comments on topics listed on the agenda. A person wishing to speak must sign in and provide all information requested on the sign-in sheet, including the agenda item they will be addressing. Thank you. The board president will call speakers up by name, announcing their time to comment. A time limit of 5 minutes per speaker per agenda topic will be imposed. The purpose of requesting such information on the sign-in sheet is to obtain the correct spelling of the name of the speaker and contact information, which will be used for any necessary board follow-up. All right.
You can explain how we're going to do the
Oh, yeah, so as we do, we have a significant number of people who would like to make comments. We will be doing 5 minutes. I will have a timer set for 4.5 minutes, at which time I will let you know that it should beep, and then Dr. Arnold will let you know when the final 30 seconds has expired. Okay. Our first speaker is Michael Dean.
Before I start talking, I just want to say congratulations to your son and my great thoughts with him being in the service.
Thank you for your service too, Mike.
Thank you. My name is Mike Dean. I just want to say thank you for the board and all the people that are here to give us this great opportunity to talk about this. I listened to your presentation. There was a few questions on my mind. When I look at the television or when the CDC comes out, it says 0.009% that are infected with this. What is that? You get more car accidents than that. What are we talking about here? Masking up our children. I listened, I was a Teamster for 42 years. Been on picket lines. Fought for the right for union people. But when he came up here and said mask, wait a minute, I'm a taxpayer. Unions are meant to be one thing, and that's to keep management honest, not the taxpayer. The taxpayers are the ones that pay their salary. They're the customer. And that customer has to be treated as such. These unions and the teachers union right now, when he came up there and said that, I almost fell over. That's what the teachers want. Mask up. Bow down to them. Well, I wouldn't bow down to them. And if my kid was coming to this class here or this school here, because I am a big advocate of parents making decisions, not the school board, not the bureaucracy in DC, but the parents. They're the ones. And that's where my service comes in. A Vietnam veteran, served in Vietnam, saw a communist. I saw what the doctor said last night, and then give the parents the right that didn't want to send their child to school without a mask. Now they have to send them with a mask. They have no choice. This is what our government has done to us because of communist China. Yes, I'm a little ticked off at our country, at our school system. Nothing against unions. I love unions. But you got to remember, we're the customer. And every time a teacher goes up there and you got the board sitting up here and they're all looking at one another, do we mask or we don't mask? And your presentation there was excellent. You have no qualms with it. But this comes from the University of Chicago. Some of their talking points here with the CDC, and that changes every day. If you took a look at the mayor from DC, she says they got to mask up. Did you see her on television sitting in a room without a mask? This is what's going on in our country, and we have to bow down to this. Will County, I mean, you got the federal government pumping money, like you said, they're not going to be charged. Yes, we're going to be charged. It's my taxpayers' money. I'm paying for it. I listened to Joe Biden, they says, oh, this is free. We're just going to hand out money. No, it's not free. We'll be paying it down the road. It's like I said, I'm in love with this country. And what I see going on and telling us what we have to do now when there's no reason to do it. We have illegals coming up from the border that don't even wear a mask. And where are they going? Texas. And where's the outbreak at? Texas. Isn't it phenomenal how the news media and the propaganda all speak this? It's like you were saying, we want our kids to be safe. We want all this to be ironed out. There was no problem in June. All of a sudden, now there's a problem. To me, there is no problem. Let the parents talk. Let the parents decide. If the one person wants to wear a mask, let them wear the mask, just like you said. If the other one doesn't want to wear a mask, okay, but then you're in a bind. I understand what they're coming down with you on. You have to do it or it's your job.
You have 30 seconds.
Yeah, call up your congressman. You have to tell them, whoever your congressman, I know mine is Newman and I call her every day and she sends me nasty letters. But that's all right. That is my right. And don't stop talking and tell your kids what's going on. This is a shame. It's a shambles. Look what we're talking about. I want to go fishing. I just want to relax. I want to spend my few years with my grandkids just having a good old time. But it's not a good old time with me. They woke me up. The woke me up. You can't even call your mother anymore. Is this what we're teaching in school? She's a birthing person? This is a joke now in this country. Wake up, teachers, parents, grandparents, grandmothers. God bless you and God bless America.
Right. Magdalena Kreisek? Okay, thank you. I appreciate your generosity and how
Thank you for giving me the opportunity to speak today. I have two kids at Oak Prairie Junior High, so my comments very quickly. I have done my research, regarding COVID-19 starting in January of 2020. I use various sources. I have followed very closely ever-changing, federal and state guidelines. One fact is clear. The science does not change. Our human interpretation of data and the moving goalposts change. I feel fully capable of making health decisions for myself and my kids. I do consider CDC and the IDPH guidelines. I do talk to my physicians. I listen to my doctor, and I make medical decisions on my own. However, I do oppose when a government body, whether it's a county or a state or even federal body, makes these important decisions for me and my kids. So getting a vaccine is a medical procedure. Wearing a mask is a medical device in this context. Both the vaccine and the mask can be considered as a protective measure against COVID-19. However, it can also be considered as harmful to the health of one's health, depending on one's health issues, other health issues, or the lack of adequate research. Further, testing is usually done in a medical facility by professionally trained staff for a reason. That is, if symptoms of infection develop and with consent. Again, these decisions on getting vaccinated, wearing a mask, getting tested belong to a parent. And these decisions are protected by the law. Parents know the kids' health the best, and they know what they need, their kids' needs. Having said that, I truly respect every personal decision, whether it is to getting vaccinated or not getting vaccinated, whether it is wearing a mask or not wearing a mask, because there are reasons a person or a parent makes these decisions, right? There's a number of factors. There's health issues, physical, emotional, psychological, type of work, exposure, living circumstances, etc., right? So let us all respect one another without bullying, shaming, and pointing fingers. So if we respect each other, let's provide choices for all, right? Regarding these very important medical decisions. Another point I wanted to make is the discriminatory practice of testing and quarantining unvaccinated students because of a close contact based on CDC recommendations. I have prepared this earlier, and what I just heard from Dr. Arnold, this is changing a little bit. I guess now it's not only unvaccinated, it's whether you wear a mask or not wear a mask. To me, this is discriminatory. I believe I believe that I am very concerned actually that healthy kids will be forced to unnecessarily quarantine and lose very precious learning time. As educators, you should be weighing this factor into your decision-making process. And I do believe District 92 has its own data from the 2021 school year as evidence that very low percentage of kids who were considered close contacts were actually infected. Again, please consider in your decision a well-established scientific fact that COVID-19 risk of death or serious illness in kids ages 0 to 18 is statistically 0. Additionally, all adult family members, kids 12 years and older, school staff have the option of getting vaccinated and or to wear a mask. There are a number of treatment options available at hospitals, ranging from antiviral medication to steroids. Therefore, I am requesting the board to make logical decisions regarding wearing masks, testing, quarantining based on science, which includes a very minimal risk to kids, while adversely impacting them academically, emotionally, and psychologically.
You have 30 seconds.
I am demanding that parents have the choice and make the medical decisions for their kids regarding vaccines, wearing masks, and testing. Since we are debating the issue of wearing masks in school and the layered protective measures approach recommended by CDC in combination with science, including the risks and treatment options, I would like to also introduce another idea. And I understand from what I heard from Dr. Arnold, we are able to keep the distance, the 3 feet to 6 feet distance. Now coupled with the last year's data, the kids do not transmit the virus in school setting while wearing masks. So my proposal would be, what if we allow to take masks off while in a well-controlled classroom during class, when students are actually listening to instructions, the teachers are teaching, speaking clearly without the mask. Students can focus on paying attention and doing their work. However, when you have a less controlled area, space, such as when in Oak Prairie, when they're changing classrooms, maybe that's, it's time to put on the mask for a couple of minutes. So in order for them to move around.
Okay, thank you.
That's another option to consider.
Right, Jenny Lee Gamino.
Hi. Is this just agenda items? Because I have both.
Sorry, yes, at this time it's agenda items.
Okay. So I'll just speak on masks then. I'm Jenny Lee. I'm actually from the District of 92. I'm an alumni here. I absolutely loved my time here. I was very involved in school, sports. I loved it here. My only requirement 9 years ago when looking for a home was that it did have to be inside the District of 92. So fast forward to this year, my daughter, my oldest, will be in kindergarten. And we are in the District of 92, but we chose to keep her at the private school that she was safely at last year, year-round. So masks. All I keep hearing these last 18 months are students, kids, children are resilient. They're resilient, they'll be fine. And while that's true when it comes to their physical body, if my 5-year-old and my 9-year-old grandmother have a same break, my 5-year-old is going to heal quicker. That is not true in regards to their emotional, mental, and social health. They are not resilient. And that's why these past 18 months, we have seen an increase in suicide, in eating disorders, and anxiety, and self-harm. Those are all on the rise. Okay. So no, kids are not resilient. I don't know about everyone else here, but I do not co-parent with the government. I can make my own decisions for my children's health without the government's help. And I hope that you guys as elected officials can make those decisions without the government's help as well. I heard something today that really struck something with me. It's someone said, it is our adults' purpose to care for children, to look out for children. It's not children's priority to look out for adults. This is a virus that we're talking that virtually has no effect on children. Virtually no effect. And that's from the CDC. Okay. So we do not need to make decisions for the kids to save adults, to save grandma. Okay. You guys were elected to do what's best for the children and not what's best for the government. To do what's best for the children. And what's best for the children is to think about their emotional and, like I said, their mental, their social health. We know that this virus is not affecting them. They're going to get sick. President Biden, in his speech on Thursday, said while cases may increase, hospitalizations and deaths will not. So people may get sick, and that's true, but they will not need to be hospitalized and they will not be dying. And I hope that you guys make the decisions to allow parents the right to choose what's best for their children and to have no repercussions based on those decisions. I really hope that I can, in the future, enroll my children back into District 92. I hope that I can gain back the pride I once had for this district. And that's all, I guess, on the agenda items.
Thank you. Beta Pak?
Hi.
Yeah.
Good evening. It's nice to see everyone in person. I've decided to come and speak on behalf of my children. I have an 8th grader and a 3rd grader at D92. I may go off script because you did give me something to chew on, so bear with me. I do ask that our district fall in line with our sister district 33C and New Lenox 122 with masks recommended, not required. I feel we're at a point in the pandemic which those that wanted to get vaccinated had plenty of opportunity to do so. There are treatments available that weren't available last year. It's time to slowly start resuming some sort of normal life. Personally, our family has had an incredible maskless summer. We've traveled, we've gone to the auto show, we've gone to MSI, several events maskless. And I know we're not the only ones. There are plenty of family and friends that have done the exact same thing. And I think it's just time that we look at bringing the kids back so that they're able to see their teachers' faces and they're able to look at each other and see each other's smiles. I completely respect and understand there are high-risk circumstances in which mask wearing is best due to family situations. And I respect that we all have a choice, masked or unmasked. My kids attend Taekwondo, which is mask optional. And there are kids that are unmasked and there are kids that are masked. No one says anything. There's no judgment. We respect each other. Personal choice. I myself have an autoimmune disease. My husband has health issues. We both chose to get vaccinated. And this is where I'm going to go a little off cuff. We are definitely not anti-vax. We have all our shots. But for our children at this moment, we're vax hesitant. There are just not enough studies out there on these Pfizer vaccines. We are not comfortable getting them to our kids yet. I myself had a reaction, and based on that, I'm like, no, I'm going to step back. I'm going to take a step back. It was more than just a fever. So it wasn't like your 24-hour fever and I jump right back. And so I'm a little concerned in the plan where the different levels are, where vaccinated students will be able to go unmasked and unvaccinated will have to wear a mask. I do not want my children to come home and say, Mom, I need this vaccine. I don't want to wear a mask. Not until I'm ready. It might be 6 months from now, might be a year from now. I don't know. I'm not saying no, it's not off the table, but I want I want to be the one to make that choice. And I don't want to have to, say, sorry, you have to wear your mask. So just please keep that in mind as we are making these plans and going through these levels. Currently at my work, we do have a mask unmasked rule based on vaccination status. And even with grown adults, it's awkward. I will not lie. I mean, we have 40, 50, 60-year-old people saying, "Shh, you see, they're wearing a mask, they didn't get the vax." I mean, seriously, grown adults. So can you imagine in middle school? Oh my goodness. Anyways, okay, back to it. As far as the count for the COVID count, I know it exists, I know it's real, but I'm concerned that we have political figures sounding alarms when it's time to go back to school, that the kids are going back to school, everyone's gonna get sick and die. Meanwhile, we just had Lollapalooza and that was totally fine. Like, anyone just thinking about that for a second, it's very concerning. I acknowledge COVID is totally real. I've had family members in the hospital with it. I know it's very serious. And it's part of the reason I chose to get vaccinated. But my kids have complained that they can't understand their teachers in masks. It's hard, it's uncomfortable to breathe. And my daughter mentioned last night, we were watching the LTHS meeting, board meeting, because I have one in high school. And the board president, every time she was announcing someone's name, would remove her mask. And Dr. Arnold had to remove his mask to be heard, right? Just to be heard. So now imagine being in school, trying to listen to your teacher, and her mouth or his mouth are covered by a mask. And same thing with their peers, right? They need to be heard. So as I was kind of playing with all this in my mind, I kind of went along with what Magdalena said. And I'm wondering if there's a chance, if they do need to wear masks in common areas, okay, wear a mask in a hallway, changing classrooms, whatnot. But when they're safely sitting at their desks and the teacher is up by the board, can she or he, take off their mask so that the kids are able to see what their teacher is saying. My third grader, he just loves to daydream. And so if you cover your third graders, the teacher's face, he's going to see just her eyes. He's not going to see her expressions. And I can see it already. That's going to be him, he's going to be looking this way and that way. He's not going to focus and see what his teacher wants him to learn. I want our kids to be safe. And I want them to learn. So I hope that we can come together with a common sense, safe approach in returning to the school year. Thank you all very much for your time.
Richard, Brad, is it Shaw? Okay. I wasn't sure on last one.
Hi, everybody. I raised 3 children through this district that have grown up, and now my grandchildren are getting ready to enter this. And last year I put my grandson in St. Andrews. So I took him out of the district just because, all of the requirements that you guys are stating that pretty much are implementing these plans, that sector of school didn't require that stuff. I'm thinking to myself, is it because I still pay my taxes to pay for you guys, but I had to come out of my pocket to pay the Catholic school system to put him in there because I just thought it was a better system at that time. I mean, so I got to give you guys money and I have to pay for that. And the curriculum that they're teaching is so different than our school system. I'm just wondering, why is that such a difference? And why aren't they following the same guidelines that our district is here in Lockport? So when you're mandating masks, they're not mandating the mask. I mean, that's an option if you feel like you're protecting your children or whatever, or the public. But what I see, most of you guys probably had the shot and you're still wearing a mask. I mean, where's the confidence in our neighborhoods, in our government, or even our school system? I mean, if you're already protected, why do you have the mask on in the first place? A child, we all know it's not affecting these kids. But you guys have to vote on this stuff, and I think it's the wrong vote to make us Brainy's grandkids are our children in here and you make them wear masks. I mean, there's no real data, and you keep saying the CDC or Will County or all these other establishments. I don't hear them saying that. So, you know, when you guys vote on this, I mean, there's a lot at stake because what's the effects? Are you a real doctor or is that just a teaching documented that you are qualified? I mean, are you
We don't typically.
a
answer.
medical
I'll go-
doctor?
PhD. I've never said it. I was a
Okay.
medical doctor. but we
So
don't
a
typically
medical
answer.
doctor, so what is the effect of a child or even us wearing a mask? There has to be some type of effect in the long run. And that data is going to come out in a few years and people are probably going to be shocked by it, what the effect really is. And I don't think there's anybody here qualified to answer that question because there's no medical professionals here. Am I right? Probably.
I'm a healthcare professional. I'm not a physician.
Right.
That's-
So
but I-
is there a long-term effect in wearing a mask? I mean, breathing just, isn't that being, I mean, it has to have some type of effect on your breathing. I mean, your respiratory effect, this is a respiratory disease, I believe. So wouldn't that cause harm somehow to a child? Especially a young kid that's in development of his mind, his body, and everything else. I think there's some type of effect that's not going to be good. So when you guys vote this stuff in, I mean, maybe we should consider what's going to happen to our children in the long run, not in 3 weeks. And the data is always changing. You just said that, and it's going to constantly be changing. So I just don't think that's the right thing to do with these masks. I mean, you know, I might be wrong, but I don't think I am. And I think the effects down the line, we're going to see them. But I don't understand if you pay for a different school, especially a Catholic line of school, why it's so different than the public sector. I just don't see the disconnect. I mean, because you guys aren't giving, if I decide not to send them to the public schools, I'm not getting money back, right? And I still have to pay for them to do that because I just think it's a better structure and you're not requiring all of the kids. And I'm trying to understand, is the diocese different than a public school? And why are they not implementing those rules that you guys are? I mean, do you guys talk to each other about stuff? I mean, what's the disconnect between the two systems? And that's what I wanted to bring up today because it's a big difference, what they're doing and what you guys are requiring. And I know there's a virus and I think it's real, but the effects of these children, that's who it's going to affect. It's not going to affect none of us. And, you know, the mask and just the swabbing, I mean, what right do you have to swab my grandchild? And you're saying that I could sign a piece of paper and not have them requiring it, but I don't think you have the right to do that to my kids or any child.
You have 30 seconds.
And, you know, when you guys vote on this stuff, I mean, this is important stuff to the community and to Lockport because this stuff never has happened before. And, you know, you really need to get together and decide what you're going to do to actually help, you know, this school system. Because like I said, my 3 kids went through and they did good in it. So I'm supporting the community here. But the stuff, I mean, you really need to make intelligent decisions. But I mean, the diocese out there, I mean, you should got to talk to them. I mean, you're an educational person. You know, they're doing different stuff. And I believe that you guys probably could do something different too. You know, when you guys vote on this stuff, just consider the kids, you know, in the community or in Lockport. I mean, Lockport means something to me. So that's all I have to say.
Casey Haram,
Could be new.
she might be next. Oh. Okay.
Hello, my name is Casey Harum. I may not be an epidemiologist, a medical doctor, or even an educator, but I am a mother with common sense. I'm here today to defend our children and their freedom to breathe. Our children who do not have a voice in matters like these. You see, it's my job and your job to defend the defenseless. Our children should not be required to wear masks to return to school when children are the least affected by this virus and have a 99.997 survival rate. The CDC website says children have mild symptoms or have no symptoms at all. Our children have the right to attend school and interact normally with their friends and their teachers. What happened to personal choice? It's not the school board's choice to make a decision for our children, it's the parents' choice. Wearing a mask is not only ineffective, but can actually create illness rather than deter it. It impedes oxygen flow and keeps children in a state of fear. All of these decrease the body's natural immune response. Don't we want happy and healthy children with a natural immunity and natural immunological response to fight this virus off? The inability to see faces also has an impact on one's ability to communicate, socialize, and learn effectively. Aren't these some of the main reasons we send our children to school? Government agencies and entities have continued to flip-flop over the last year on whether the community should be wearing masks or not. There's no evidence to support that masks prevent the transmission of respiratory illnesses. Masks are ineffective as source control with small particle viruses. A face mask filters out particles larger than 0.3 microns. Coronavirus is 0.14 microns, which basically means it shoots right through the holes in a mask. In an article dated August 2020 by BMJ Open, a professor of epidemiology and hygiene found that 97% of particles permeate through cloth masks. Furthermore, much of the mask research that's been done has been based on laboratory studies with perfect use and fit and not real world scenarios with children. When's the last time you saw children or a child with a mask that was perfectly fitted without any gaps around the nose or anything like that? According to the Aerosol Science and Technology 2021, a 1% gap in the edge of a mask will leak 50% of virus particles. A 2% gap will leak 75% of particles. Most of the time when I take my child to school, the mask is like all the kids, right? That's like hanging down over their nose, not even covering tight around their face. It's just not practical or realistic to think that kids are going to be wearing these masks properly to actually have any kind of proven effectiveness. The CDC even admitted that they are not aware of any randomized controlled trials that support face mask mandates for COVID-19. Kids are constantly touching their face with dirty hands, fidgeting with it, contaminating the mask. Exhaled viral particles get trapped in the mask, basically creating a petri dish for the virus to replicate and other bacteria to replicate as well. Excuse me. Masks examined under a microscope contain a variety of microorganisms like bacteria, yeast, and fungus. So even though we're trying to put masks on kids to prevent the spread of COVID-19, we're also creating this bacteria petri dish on their face to further, cause other infections and things, other sicknesses that we don't want our kids to have, rashes on the face, staph infections. I've heard a lot of different stories about those types of issues. A randomized control trial comparing medical masks and cloth masks found that those wearing cloth masks were 13% more likely to experience influenza-like illness. Not to mention these other infections that I just mentioned that are due to the bacteria building up in the mask. We also need to consider the transmissibility of COVID-19 between children and adults. The numbers that are surrounding this are extremely low. A report published February 11th, 2021 in PLOS Computational Biology found that people under 20 are half as likely to transmit this virus to other people. Children experience lower infection rates, accounting for less than 10% of cases in the United States. Overall, children are thought to account for only 1 to 2% of COVID cases worldwide. Another investigation of 4,964 participants published by the Journal of American Medical Association on January 22nd, 2021 states, children do not play a key role in SARS-CoV-2 spreading during the current pandemic. We must also consider the psychological and developmental impact, which I know some other folks have mentioned this evening, of kids wearing masks. Masks prevent kids from seeing emotion and nonverbal cues and hearing the instructor's direction. They learn by looking at facial expressions and reading lips for better comprehension. Research has shown the ability to encode, interpret, and organize emotional and social information are skills needed to both engage in learning and to develop in self and social awareness to make responsible decisions. These are critical developmental skills that the kids should be getting in early childhood education. There's substantial evidence supporting kids are medically, physically, and psychologically harmed due to mask mandates. An MIT pediatrician said that he sees more negative mental health effects in isolation than COVID. Mental health illnesses and cases that others have mentioned as well are up 300 to 400% now compared to years prior to 2020.
Wearing masks is ostracizing, divisive, and a symbol of separation between children. Children need to be able to have normal human interaction and development in their well-being. So the question that I asked to you guys is, does the benefit of wearing masks really outweigh the harmful side effects that we know of now and the ones that may be coming down the line, as another parent had mentioned? I feel like we're taking advantage of the most defenseless and vulnerable group in our population, and we really need to make the right decision for our kids.
Jason Herman.
Good evening, everyone. Thank you for letting us speak. First, I'll start off with, I've been an educator now. This is my 20th year in education. And I too am facing the different choices within my own district that I teach. But I'm here on behalf of my students that are here, my children. I have an 8th grader, a 4th grader, and an incoming kindergartner. And after a lot of talk within just a family or a party within the neighborhood this past week, there was a lot of talk about the different mandates and masks. And afterwards, I'm at home, getting my 4th grader ready for bed. And he just, came to me and said, "Dad, like, if I have to wear, I don't want to go to school if I have to wear a mask." And this is a child who loves school. All of my children love going to school. They love being a part of school. We've done athletics through here, District 92. We've done different volunteer events and different things. And to have your 4th grader who's full of love and life and joy to come up to you and say, "I don't want to go to school." It's being an educator. It really, hits home. I've seen it in my own classrooms. There's been more social emotional disparities in kids. There's been more. It's just alarming how many more students I encountered in my own caseload that have, had social emotional distress, different, suicides and hospitalizations, and have just the number is alarming. And I think as a school board, you need to think about those things and the psychological effects it has on students. And again, it hit home just this past week for me. Really hit home, and I don't know what to say to them. We are very seriously considering not sending them to school and possibly homeschooling, or looking at the other options that are out there. And again, looking at, as the woman that just spoke, do the benefits really out, are they that much more just because maybe we don't have to quarantine because we wear a mask? I don't know if that's the right reasoning as to why we should make it mandatory. If we want to choose to not send our child with a mask on, and that means that we have to quarantine, then that's the choice we made. We can't get upset with that. I would, if that is the option, then I think, parents knowing that, then how could we get upset? But again, let us have that choice. Let us have that own struggle to make that decision. And that's all I have. Thank you.
Thank you. Tracy Hurd.
I'm not gonna speak because like 3 people said exactly what I was gonna say, and there's still a lot of people in there that probably have other stuff to contribute, and since everything I wanted to say was already said. But thank you.
Okay, thank you. Michelle Bahan, sorry.
Excuse me, sir. In that room, when you guys call the names, we cannot hear the names.
Okay.
So something or other got to happen, because you can call somebody, we don't even know that you're asking to come up.
Okay.
Hi, I'm Michelle Vlahovic. I look at this from a different perspective. I am a high school teacher, and today I sat at a poolside with 9 of my colleagues. And we talked about a lot about COVID. And one of my colleagues, science teacher, wears this. And we all respect her for that. We understand that, granted, she's vaccinated, but she is extremely concerned about the virus. And so she wears this in order to protect her. And actually, she wears an N95 because as science teachers, we know this one's not effective. Okay. So she wears an N95 and she wears the shield in order to protect herself. Also sitting next to me today was another teacher who's not only had COVID, but she's also had the vaccine. She's not concerned at all. She could care less if she has to wear a mask or not, because she knows that her immune system is extremely built up to this. And she's got 2 small children at home and an elderly adult who's also vaccinated, but she's not concerned. So we all have our standpoints. And the thing is that we should have a choice, and we should also be teaching our children about how to not bully when it comes to that choice. I've seen a lot in these board meetings where people are attacking each other. My father says to me, "Why are you wearing that diaper on your face?" That's not acceptable. We need to teach children and adults better. And when my brother says to me, "Why aren't you wearing a mask? You're responsible for 600,000 deaths." That's not acceptable either. We need to teach our children to do better. And in all honesty, this is a perfect opportunity for it, because of the fact that it's kind of hard to talk about gender choices and sexual orientation and things like that, where we should be respecting each other's choices. But this kind of thing right here, we can teach our children that both sides of the argument have legitimate concerns, and we should be respecting all of those bodily choices. Now, I had a whole thing prepared and I changed it because of watching the presentation, and I do have a couple of questions. The PDF that was put online says that the superintendent is going to make all of the choices. But yet it says that we're going to be basing those choices on our school metrics, but we were not presented at all what those school metrics were. And yet in the presentation, it was also stressed that it was going to be school metrics and not countywide metrics, which I completely agree with. But what are those metrics? What is low? What is moderate? What is high? So I'd like to have that explained. I also don't agree that one individual, the superintendent, should be making all of the decisions as to when we move from place to place, because usually when we make large decisions like this, we do decide in committees that are made up of the public and teachers and everyone, not just one individual person. I also would like to ask if, since we're testing our kids each week with the shield testing, why is it that we have to have a 2-week metric? I've got data from my school board where we tested over 4,000 individuals. So what is the positivity rate that we're deciding when's low, moderate, and high for our district? So I'd like to share this with you. Also, why 2 weeks? Why, if I have a saliva test that comes up negative on Monday, why can't I, if I choose to wear a mask or not wear a mask? I mean, shouldn't our testing be used to make those decisions as well? And even get us out of quarantine. If I go to physician's immediate care, I can go and get a 15-minute test. As a matter of fact, I did it last week because I had a cough and I wanted to make sure that it wasn't COVID, because you know what? I don't want to spread it to anybody who decided they didn't want to get vaccinated. So why can't we use mitigation methods like that as well to get those kids out of quarantine also? And sorry, I had it all prepared and everything got changed because I couldn't see the PDF that was being presented prior to the meeting. So I've got lots of questions that I'd like answered with all of this. Yeah, I guess I will finish with, I've got more than 30 seconds, correct? Yes?
Yeah, about a minute.
Okay, so my son wanted to come tonight, but he has soccer practice. So I recorded what he'd like to say. So this is coming from an 11-year-old child, and I'll play. So why don't you want to wear a mask? What makes it hard for you?
If I say something like wrong or hurtful to that certain person, I can't tell if they are offended by it when they have the mask on, because I need to see their facial expression when I say something bad, like if they start to frown, if they.
So my son's at an integral part, and his big concern, he's going into 6th grade. He's concerned, he's got 3 close friends. He is really concerned about making new friends in junior high. Out of 60 plus suicides in Illinois, I knew 2 of them this year. I didn't know any hospitalized students. I sent more lessons for hospitalized students because of depression and anxiety. My own children are now in counseling, and what do we talk about? COVID impacts. We all go together. These are things that are hurting our kids, and I really want you to consider that. Thank you. If anybody, if at the end of the meeting you would like the data from my district, it's available online. You can see their numbers, but questions I'd love answered. Thank you so much.
Thank you. Chrissy Sherry.
Hello, everyone. My name is Christina Sherry, and I am a former educator and a mother of a very anxious, soon-to-be kindergartner. I am not someone who takes sides. That is not why I'm here. I'm simply a truth seeker, utilizing my energy on educating myself on facts. I think we're all here, no matter what side you are on, because we want the best for our children. I'm here today to request parental choice when it comes to the mask wearing, so that this year can be exciting for my daughter and for so many other kids just beginning their school career. As I can't stand here or sit and speak for every other anxious child entering into this school year after last year's chaos, I can speak for mine. Deep breathing is a tool that we use at home to help with nervousness, worry, and anxiety. My daughter relies on this practice to calm her when her worries become too big. We use the relaxation response technique, first developed in 1970 at Harvard Medical School. But we all know this fancy type of breathing as belly breathing. Deep abdominal breathing encourages full oxygen exchange. That is the beneficial trade of incoming oxygen and outgoing carbon dioxide. Hearing that masks have a chance of being mandated again after thorough and substantial research has been done on the sorry, I'm struggling with my nerves. The inefficiency and harm masks cause our children is simply absurd. It's absurd for the simple fact that there is no supporting research, study, or any significant finding that proves masks are good for our children's health or aid in preventing the spread of COVID-19. As a parent, it is my job to advocate for my daughter. As educators, it is your job to to stay educated on the topics that directly and indirectly affect the classroom and your students, like masking the children. As a truth seeker, I have found some scientific data and facts that I wanted to share today. In simple science, one of the first few intrinsic life requirements is oxygen, something that fuels our brain and body. Breathing in oxygen and exhaling CO2. We all know this. When we breathe, the glucose molecule is then combined with oxygen in the cell of the body in a chemical reaction called cellular oxidation. Carbon dioxide is considered a simple asphyxiant. I can't say that word, because it reduces the amount of oxygen we absorb from each breath. Put simply, when we breathe air with high CO2 levels, the CO2 levels in the blood rises. reducing the amount of oxygen that reaches the brain. And this is all according to a study done at the University of Pennsylvania and University of Colorado Boulder. What happens when we breathe in too much CO2? Again, a little more simple science. 350 to 1,000 ppm, parts per million, is a typical level found in occupied spaces. 1,000 to 2,000 ppm is a level associated with complaints of drowsiness and poor air quality. 2,000 to 500 ppm, this level is associated with headaches, sleepiness, and stagnant stale air, stuffy air, poor concentration, loss of attention, increased heart rate, and slight nausea. 500 ppm, this indicates unusual air conditions where high levels of other gases could be present. Toxicity or oxygen deprivation could occur. This is the permissible exposure limit for daily workspace exposures. In a randomized clinical study conducted in June of 2021, I'll skip that. There was a study done of kids aging from 6 to 17 using N95 and surgical masks. The youngest of that group testing the highest for CO2 levels. How can anyone on either side fail to see these numbers? If you've done thorough research, you would also find that hypercapnia has been reported as a major side effect from wearing masks for an elongated amount of time. In closing, I'm simply asking for the choice to be given to each and every parent to do what is right and healthy for the well-being of their child, as that is our God-given right. Thank you.
Steve Ballots.
Hello, everybody. I'm going to tell you, my kids went to school here, but if my kids were in school right now, I'd withdraw them all. I'm disgusted. The presentation that I saw beginning this whole thing today is all flawed. It's based on false things. First thing, I'm not a global citizen of the world. I'm an American citizen, and I get really aggravated when I saw that. You're teaching our kids to be a global citizen of the world? Are we globalists in this school, or are we Americans? That makes me real mad. But now we're going to talk about the statistics. You're basing everything that you're hearing from, I'm seeing, the World Health, but you're saying CDC, Will County Health Department. Well, I'm on the Will County Board, and I represent this district. And back when COVID was going really strong, I asked the health department a question. How do you base your test? How do you get that number? And they don't want to tell you. They don't want to tell you the number of people that died of actual COVID, not somebody that got in a car accident and died of COVID. They don't want to give you any of them statistics. So over and over and over again, we ask these questions. Then we find out something real interesting about the Will County Health Department. If you got a COVID test and you're tested positive, so now your work sends you to, you can't go to work, you're quarantined for 14 days. But you don't know when you got the COVID test. So you might go back in 3 or 4 days to get another one to see if you can go back to work early. Okay, that counts as 2 tests for one guy. The next time you go back, you can get 3. You can get as many as 4 or 5 tests before you are considered 5 people, but you're 1 person, but you're considered 5. So all those statistics that they were given was false, because if you had 5 tests, You're not 5 people, you're 1 person. So right out of the get-go, I can tell you one thing. All them numbers that you read are all full of baloney. All of them. There's nothing factual. The World Health, that thing, WHO, same thing. False numbers. CDC, all they're saying is recommendations, guidelines. We don't have to follow guidelines. We're American citizens. We have freedom. We do not have to listen to a guideline. It's not a law. So just think about the CDC. They say that you shouldn't have ice cream from cookie dough, right? That's bad for you. You shouldn't have batter from cakes. That's bad for you. A while back, you shouldn't eat eggs because they're bad for you. Then they changed their mind. How about when they locked down all the people that were healthy? That never happened ever in the world. When people were sick, they were segregated from the healthy people, not the other way around where everybody goes in segregation. All this stuff is manipulation by a controlled factor, the global government. And you know what? It makes me sick when I saw that on the thing that said global society. My God, we're playing right into their hands. And you are elected officials just like me. We represent the people, and we're supposed to do what the people want, not what the CDC says or anybody else. We represent people. And if the majority of the people, which you guys should know, do not want masks at all, it's your job to vote no mask. And if somebody does want to wear a mask, God bless them. Let them wear a mask. Nobody cares if you wear a mask. But if you don't want to wear one, you're not required by law. All this malarkey that we're hearing is just that, a bunch of bull.
You have 30 seconds.
So it's your job as elected people to listen to all these people and really take consideration what I said. We are not global citizens. We are American citizens with freedom. And I am very angry, and I'm sorry to say that because I thought I wouldn't be this mad.
The last name is Walters. John or Joan? Okay, thank you. Oh, right there, please.
Hi, guys. John Walters, taxpayer here in Homer Glen. First, I wanted to start off with, there's an experimental vaccine. It's an experimental vaccine. We have no studies on the long-term effects. We're going to put it into our children. We have no idea what it's going to do to them 5, 10, 15, 20 years down the line. Putting it into an old guy like me, that's one thing. You know, I don't have that many years left, but you're putting it with the kids. We don't know what's going to happen with it yet. We have no long-term studies. Second, okay, I'm immunosuppressed. This is my story. I've been immunosuppressed and immunosuppression since I was probably 13 years old, 12, 13 years old. And I have a transplant. I'm on more immunosuppression. The whole time, the doctors are telling me, don't touch your face when you're out. Wait till you get home, wash your hands. Right now, these hands are dirty because they've been touching things. You don't touch your face. Every single one of you, I'm watching you on the video in there, you're touching your face. You didn't sanitize your hands before you touched your face. And after you touch your mask, you're supposed to be sanitizing your hands again. You're not doing it. If you can't do it, how are you going to expect the kids to do it in class? They're not going to be sanitizing their hands before they touch their face, and they're not going to be sanitizing them after they touch their mask. And then if they do have things on their mask, that because it's wet and warm, it's a medium for bacteria, they'll be spreading it around. Next. If you guys can't do it, do proper mask techniques. You're not going to get the kids to be able to do it. They can't do it. You're making it more difficult, more likely for them to spread things around. When this first started and I'd go into the grocery stores, I'm watching people touch their mask, touch their mask, touch their mask, touching the produce. The guy checking out my groceries, touching his mask, touching my stuff, putting it in the bag, and I'm just shaking my head. These people are going to get me sick with their masks. Because if they do have something, they're putting it on my stuff. This, one of the fatalities of COVID, or two of the fatalities, have been truth and science. They've taken a backseat to political agendas. Political agendas are coming out of Washington and Springfield. You guys are here to represent the children. You shouldn't have a political agenda. You should be representing the children. You should not be making them wear masks. You should not be making them take untested, long-term tested vaccines, because we don't know what it's going to do to them. I think watching you guys from the other room touching your masks and not cleansing your hands, right now, every single one of you, I challenge you to take your masks off. You shouldn't be wearing them because you can't even follow proper mask techniques yourself, let alone the children. That's all I have to say. I don't need my full 5 minutes.
Ryan Johnson.
I do share Steve's disgust with global society and the vision statement about live local instead. But anyway, my name is Ryan Johnson. My kids used to be in 92, but we're now in 33C in the high school, but I'm here to continue to fight for all the kids in this district. Last night, our high school board had a real opportunity to be leaders, to really listen to the nearly 24 parents who passionately spoke out about unmasking our children and doing the American thing of letting parents decide how to handle their children. Unfortunately, they made a very, very wrong decision. I don't know this board here in front of me, but I really hope you're different. As a relative newcomer to board meetings, I've been about 4 now, I can hopefully offer a different perspective. For our high school board, I noticed 3 types of people. First, you have the silent ones. Few people, I don't think, opened their mouth once in the 3 meetings I've been to. Why are you here then? You're not getting paid. You're obviously not serving the people who elected you and their children. Completely useless. Then you have the lapdogs. Few people are just lapdogs of the superintendent, lobbing canned softball questions during Q&A. You know, the ones that constantly forget that the superintendent works for them, not the other way around. These are actually the first people I want voted out. But you do have a couple of patriots who we saw last night who believe in our flag, our country, and our freedom of choice, parental choice to make decisions that are right for their children, belief in the obligation to serve the people that elected them, belief that health agency recommendations are only that, recommendations, not law, not mandate, even if they do put the word strong in front of recommendation. These 2 people were unfortunately outnumbered last night. I hope this board is much better represented in this area. And of course, you have the superintendent. I hope this district has a good one that serves the best interest of the students and the families they work for. But with everything I've heard so far tonight, I highly doubt it. The high school superintendent, Mr. McBride, let me share something with you that he told me in a private conversation about 2 months ago. Mr. Johnson, it's really only people like you that have a problem with the masks. And what I mean by that, it's people over 35. Only people over 35 seem to have a problem with masks. All the people younger than that don't really have a problem with masks because they know they're doing it for the greater good. One of the most appalling things I have ever heard in my life. If anyone on this board even slightly agrees with that statement, I urge you to resign immediately tonight before the vote. So our parents pushed for mask-free school opening last night. We don't obviously respect guidance from CDC, IDPH, ISBE, or a governor who is not the picture of health. We know this has nothing to do with public health and everything to do with control of our children, and all this for a fake pandemic, which is just the flu. All these boards talk about liability and risk. Board keeps saying, well, if we take away one mitigation factor like masks, we have to replace it with another. So I give credit to one of the two board members yesterday who says he gave several options to the board in the week or two leading up to the meeting, but no one wanted to hear him out. They already had their mind made up. Here's a proposal for a risk mitigating strategy, and it's really cheap. All right, you're gonna take the masks away. And as a school, how about we really put a focus on health and wellness? Something no one will address. Government, media, schools, no one wants to talk about it. Let's raise the bar in gym class like it used to be. How many varsity athletes were failing sections of high school gym class during heart rate monitor sessions? Couldn't get their heart rate past 40 to 50. Fails that section, but the kid who can barely get off the couch takes a few steps, gets 140 beats and gets an A in gym class. How about we make health class really health class? Physical and mental health. Tell the kids the truth. Vitamin D and zinc significantly reduce symptoms if you get COVID. You don't need a vaccine. But that strategy doesn't make money, does it? Mental wellness, coping techniques, meditation, mindfulness, whatever you want to call it. Kids are suffering and need a way to cope. So I really do hope this board is different and makes the right choice in reopening schools. It can be done safely without masks. You can still take an aggressive approach and still work within frameworks.
You have 30 seconds.
Thank you. And recommendations set by Illinois health agencies. Recommendations. Masking children is child abuse and it's a violation of civil rights. So I beg this board, be brave, be bold, be different than every other school who's on their knees right now. Last night, we saw amazing energy and parents are now awake. More accurately, the Lions are now awake. I almost felt sorry for some of those board members as they walked out last night. I said almost, especially with the fury of mother lions protecting their children. Make the right decision, board. Let these kids breathe. Be happy and free as they start the school year. Do not approve this resolution up for vote tonight. And please don't ever say like McBride did, they're doing it for the better good.
William Jeffries.
Not here.
Okay. Robert Cruz.
How are you guys this evening? My name is Robert. I met some of you out in the hallway. It was nice to meet you. I'm also a school board member too. I'm in District 229. I face the same challenges that you guys get to face here. I've faced the same crowds that you've faced. In our district, we decided to go with mask optional because of our moderate low metric based on what the recommendation was. And I'm not going to take a lot of your time because I know that you have a lot to do tonight and these people do too. I've heard a lot of officials, including people in my own room, talk about trusting the science. And when it was my turn to talk, what I said simply was, I've been trusting the science. We've learned more, but now it's time to trust the parents because they are the ones who care about their kids the most. I don't know anybody who loves my daughter more than I do. Maybe her mother, probably Jesus. And I think some of you probably are parents and mothers. I don't think anybody loves them as much as you do. And so I don't see why it isn't possible with, especially with the recommendations. I've seen everything that you've seen, right? I've gotten all the IDPH, I've seen all the ISB, I've seen the IASB, all of it. And I think they're giving us the choice so that we can try and repair the relationships that we've had with our parents too. You know, we actually offered a forum up for parents to do a town hall. We're doing it on Monday, where parents can talk to us and we can mend the fences. Because how long can we continue to do this? How long can we continue to have these types of things going on? So I say, while we trust the science, I really encourage you, because there's a lot of other school boards that have seen things our way too. I think it's time for you to trust the parents. So thank you very much.
Robin Borowski.
First name was Robin Doe.
Yeah, Robin Borowski. Okay. Christina Miller.
On her way.
This one.
Hi, board members and community members. I want to thank ahead of time for listening to our concerns, either through speaking or through emails. I know your time is valuable, and I appreciate that you're listening to what we have to say. I'm here to speak as a parent of a child who will be entering kindergarten in District 92, and as a teacher who taught during COVID, and a person who actually had COVID. I am not using my 5 minutes to reiterate what we have emailed or what many others have beautifully spoken during their 5 minutes with all our credible statistics, studies, research findings, but as a perspective of what I've seen in the classroom and the negative effects it has caused the learning environment, from the negative social, emotional, and academic effects it has caused our students. My heart broke for my students when school shut down due to COVID. Their whole world just turned upside down. I am blessed where my students actually love coming to school. They love being in my classroom. Every day during remote instruction, they kept saying how much they miss us and when they wanted to come to school and they just wanted to be near us, just that connection that they have. Well, we got to do in person. And unfortunately, when they came back, they were so excited to see us, but the classroom that they knew and they loved were no longer the classroom that they had. We followed the guidelines. We did everything in our power to make sure everyone was safe. We didn't know back then what we know now. We went from collaborative centers and groups to having to sit in a desk away from each other and only staring at each other, but not knowing really what they were feeling, if they were confused. They just weren't able really to connect. I have a lot of students, they had a really hard time keeping their mask on, especially when you're in special ed. It's just near impossible, but they had a hard time concentrating on the lessons. They just kept playing with their masks. Most of the time, they weren't even on properly. My heart broke every time they would tell me that they couldn't breathe and that they were dizzy and they were having headaches because there was nothing I can do. I never knew when I went into the teaching profession that I would feel so helpless. All I could do is send them to the nurse. I also am a teacher that works on speech development. I also teach students how to read because I'm a special ed teacher and a lot of their deficits are in speech development and then also in decoding and encoding reading. It is so hard to teach them when they cannot see the formation of my mouth. They need to know they need to know where your teeth are setting the mouth formations. They need to hear each individual phoneme. They can't do that. I tried the vinyl masks and everything would fog up, and I tried many different ones. Then while I'm trying to do it, I don't know if you ever had the vinyl mask, but they go and they like completely block your airflow. And I'm going, and they're like, Miss Miller, are you okay? I'm like, hold on. So it was super duper hard. It was not helping. They rely on manipulatives because that's how they learn. And by not giving them math manipulatives or even doing like science experiments, everything like that, they were having a hard time grasping the concept due to that. I know that they also couldn't hear me. So I was also having to like compete with the mask and yell. I know you guys probably feel that way as well. And I would lose my voice. I'd be constantly drinking a lot of water. So it was really hard for them to understand me. And a lot of times I had to repeat it over and over and over again. That is not effective instruction. We couldn't, I do know that in order to learn, they have to feel that connection. They have to be able to collaborate, and they were not able to do that last year. If we know now that masks do not keep someone from catching COVID and it causes harmful health effects, which are some I've seen my, students personally experience along with myself. We've had rashes, shortness of breath, dizziness, some of them would wear the same mask every single day. So that would make me cringe. And it is detrimental, and it makes an impact on our students' learning and our social emotional well-being. You guys have the power to make my child's first experience in school, along with the rest of the students at District 92, have a positive and successful school year by not mandating masks and leaving it up to the family to make the decision on whether or not they want their child to wear a mask. I am not scared of going in. Like I said, I had COVID. I am not scared of going into work and having a bunch of smiling faces surrounding me. In fact, I miss it more than anything. I'm more scared of having students' academic, social, and emotional well-being and their health being jeopardized.
You have 30 seconds.
Okay, thank you. I'm more scared that my own personal love of learning and love of teaching is going to diminish. Then there's a matter of fact where my heart's going to be absolutely broken that my child's first experience of her school career might destroy her love of learning and her ability to learn without any health repercussions or just being able to connect with others. Please make the right decision regarding masks and make it up to the parent to decide what is best for their child. I beg you to please remember what the statistics and studies are showing us and make the right decision like other surrounding districts already have. Homer, Lamont, New Lenox, Plainfield, Oak Lawn, a lot of them are opening up with it. So, all right, thank you.
Kelly Fontaine. There's just a little bit of delay.
Hi. My name is Kelly Fontaine. I am a mom of a little girl who's going into Oak Prairie 6th grade. I run a company, small company in Lockport. I am responsible for the COVID response and protocol for our company. Small, 50 people as compared to what you guys deal with all the time. Everybody has so eloquently spoken and covered so many topics. I had a whole prepared thing, but we all know the science. Anybody who really cares about their children or the children that you guys are making decisions for, we all know it. Sorry, I'm a little nervous. I've never been to a board meeting, not one, not when I was in 33C, not when I fought for a year in court to get my daughter transferred over here to District 92. I am so moved to be here to encourage and other parents and support that we do the right things for our kids. We know the science does not lead to masks. We know this. Everybody who has paid attention, who has studied, who has not gone with what the government is feeding us, and I don't want to get political, but the government is really feeding these details. We know. I just want to quote something that the mayor of Orland Park stated, and it made a public statement. Brief. He said that what is most disheartening, I apologize. What is most disheartening to me is what our elected officials and school boards have done to our children during this pandemic. The data shows that we do not need to be requiring mask wearing for our children's safety, which means we would only be forcing them to wear masks for the safety of unvaccinated adults. Personally, I do not think our children should bear the brunt of a disease that has no impact on them to make adults feel more comfortable. Adults should be protecting our children and not the other way around. I feel insanely solid in that condensing his very elaborate statement that went into the science, went into the carbon dioxide, into what is held in these masks, into the fact that those masks don't do anything for the particles of this disease. This pathogen. We know this. We all know this. And I really am begging for the 500 people that I know from the parent groups that I am in Facebook, because social media is our connection now to be our voice for our kids because they can't be a voice. So I don't know why there are only 20 people here, because I can tell you that the voices of the parents that I know, and you guys have to know, because you get this pounded into you by all of us all the time. We want what's best for our children. I haven't been to a board meeting, and I feel, I really am, I'm embarrassed about it, that this is the first one, but that's because we give the faith in you guys to make the right decisions for our children. The right decisions, this is their health. This is, the mayor of Orland Park went into the suicide rate being like the biggest factor. My daughter, I mean, when I thought that it was handled very well last year with the teaching, I mean, she did exceptionally well. But when they went back in, she said, "Mommy, I get dizzy." She plays basketball. She went to basketball camp. They had to wear masks. I mean, that is not good. It's just, it's not good. We know this isn't good for them. And I'm begging on behalf of every adult parent that either is too afraid to be here to speak to you, or that can't make it, or that doesn't public speak and gets crazy nervous like me, even though I talk to people all day long. I'm begging that you guys make the right decision for our kids. I really am. I'm not gonna waste any more of your time, but I do thank you for your time and for listening to all of us and for taking our kids' health and mental happiness and mental well-being into consideration. Very, very serious consideration. Thank you.
All right. Now I need a motion to approve the 20.
Matt, can I just ask if we take a little bit of a break? Are we able to do that?
Yeah, we can take a recess. Before we go to the, absolutely. Sorry, it is, let's just go 9:05.
Yeah, perfect, thank you.
Do you need a motion or can I go do it? Take a break. Okay. All right, we are back at 9:06. We are back. All right, I need a motion to approve the 2021-22 return to school plan.
I'll make the motion. I'll second.
Doreen and Melissa. Okay, discussion.
I would start one question that I thought some of the speakers brought up. I do think it would be very helpful for us to explain the metrics again that were proposed, how we would look at District 92 in those 4 categories, and make that a bit clearer so that parents understand what it is that we're recommending.
Sure. So the most important part of that, and I know what the one parent was asking about, is where are the numbers? I think it was Michelle that asked about that. And as the board knows, there were originally numbers on that chart. Those only go back to the positivity rates. So let's see if I can get them from memory. If you look at those 4 categories, low, you know the 4 core. The blue was 5% or less than 5%. The next one was yellow, and that was 5 to 7.9, 8 to 9.9 maybe, and then 10 and above, I think were the numbers for positivity. We didn't make those up. Those came from the CDC guidance. If you go to the exclusionary guidance in CDC, those numbers are provided. Is my microphone not on?
It's really hard to hear the mask.
I'll pull my microphone up. So we did pull those numbers. If anybody wants to look at that, they are CDC numbers for those 4 categories. Those are for the positivity rates. So the way I would implement that, and that would probably be a main driver to look at our student and staff population. Any parent who's looked at our data from last year knows what that chart looks like. And that's exactly how we reported it out, by percentage and by case number last year. We also factored in quarantines last year. And so that's something that I would not envision including in that, because the quarantines weren't positive. As soon as they became positive, we'd add it in to our school number. The other one, I don't think we could use in D92, because you can use those same 4 categories. It's provided in the guidance for the cases per 100,000. Last time I checked, we don't have 100,000 students, so that number doesn't work for us. That's when you get 50 or more and that start getting those different thresholds. So that would have to stay with a community piece. I wasn't ready to commit to that level of specificity at tonight's meeting, but that's very much the plan that I've shared with the board and where I would expect to go with that. I don't have anything better to use other than that. I just wasn't quite ready to put those exact numbers on that chart, because we won't know. We found out today, we've been waiting as superintendents for they're taking the GIS map data for the county. The same thing we do with, like, when you pay taxes, you could look at your parcels and all that. And they're trying to link that to a dashboard that we could then use as superintendents to look at our true zip code numbers. And so we have a meeting on Friday about that with the health department. And once I see that dashboard, I want to see how my proposal matches up with theirs. And then I'd be good to go. It's my only hesitancy with the parent meeting that I'd like to do at 12 o'clock on Friday. This meeting just got scheduled and it's for, of course, 1 o'clock on Friday. So it might bump that parent meeting to next week, depending on what I find out about this county health meeting. So I think that to be more concise with the answer is I gave you the straightforward numbers, but I don't want those to be the only numbers driving it. We want to look at multiple numbers. And that rubs both ways. If there's something close, maybe it's a little above 5, but the other numbers are looking good. When you look at multiple factors, that can give you a decision to go lower with restrictions. If you're right at the cusp of 5 and you've been going towards that and all the numbers are looking really bad other than your other metrics, it's going to maybe make you be a little bit more cautious. So just having one data point, I don't know that those serve anybody well. We want it to be a little bit more malleable than that. I'd prefer no tough calls. It'd be nice to have easy decisions. I don't know that that's in the future.
Can I ask all the board members to pull their mics as they're speaking? Certainly point them at you and speak into them for the people at home and in the other room. Thank you.
So Tim, can you give us a sense of what other options we might have? I think what listening to the parents and dealing with this myself as a parent in the district, it is a tough call, and it's something that we've talked about, in the house and trying to figure out how we want to approach it. I'm in a unique position just because of my role here, but and I do want to ground myself in data. And we admit we don't have the data today because we're not in school. But the risk lens we're taking on this is let's be extra cautious going in. The alternative is to not be extra cautious, right? To think about this like let's go in as mask optional, mask recommended, following the guidance, and see where our numbers start to take us. If they take us in the wrong direction, that becomes a mitigation effort versus starting fully masked and then see if they come down. Is that something you entertained, or can you walk us through the process?
Well, that goes back to where we started. That was June, early July. And that was, we never had universal masking or anything like that on the radar. And yes, it's a careful approach from a safety standpoint for students. And it's kind of that classic, you want to start out a little bit, on the safe side and then be pleasantly surprised, like, wow, the numbers are good. We don't have the transmission. We'll all be the first ones to celebrate. Let's ease up on some of this. Or like you said, it's a valid point. You could start out with the recommended, not required. That's where we were up until probably about 2 weeks ago. And you could go that route, cross our fingers and hope that we just do a whew, or be less than pleasantly surprised and say, okay, it's middle of September and we got to go back a level backwards with masks. To some extent, it's philosophical. There's no science behind that approach. It's a decision point. I do read you can call it guidance. You can say these are not required. We all know there aren't laws. We understand that. But in the end, the shoulds matter. And when someone tells you you should do something, they don't have the ability to require it. If they did, they would do it. And everybody who doesn't like those entities would say, yeah, they would. But the fact that they don't have the ability to require it, they couldn't say any stronger that they highly recommend, strongly recommend, whatever you want to say, go this route. If I had real numbers of our kids right now and I knew what it would look like on day one, we'd make the decision. We would go hard or soft on masks, I guess is the way you could look at it. It's an unknown. And so it is philosophical for the board. How do we want to start the year? Do we start the year one way and ease up, or start the year another way and then maybe have to come down harder, or maybe not? We won't know until we get all the kids back in school. I do want to clarify, this is really focused on the students. I can tell you the initial conversations with the teachers union, one of the first things they said to me, I hope I'm not speaking out of turn, was, we support you either way. Just give vaccinated teachers the option not to wear the mask. That's all that mattered. That was where we started with this. We really tried to honor that. However, when we look at case numbers and where things are going, that tune changes. So I have not heard of one of our teachers, not one staff member, who's afraid. Please, no teacher has asked us to mask up for their safety. That's not out there. So I don't think that's a fair characterization to say teachers are afraid and all that. This is truly a decision being made out of an abundance of caution, whether you like that term or not, to protect our kids. And the second we have solid data on this is good, we're not spreading it, things are going okay, D92 numbers are good, you've seen the chart, we're going to go an easier route on masks. I don't know any of our staff that want to have masks on. Not that they won't, but this is not something we're enjoying. It's not something we're excited about. This is, when I nod at you when you're talking about the detriment to the learning process, A, got to have them in school. We need to be in person. But B, it's not ideal with masks. Everything we said about the speech, not being able to see the faces and everything, it's true. So the board does have to weigh this. I can make recommendations. My feelings will not be heard either way. It really does come down to our best guess of, and all we have to go on is the community metrics. That's why I did include that for what it's worth. Did I just talk long enough to forget the question?
No.
Okay.
I guess, maybe it's a matter of, administration, but, if as we continue to talk through this, if that becomes something that's more viable, I don't know the mechanics of entering that into, what we might, with the proposal would change, or how we might want to think that. Again, I'm just.
Let me take it a step further, Jake. I mean, first of all, let's recognize we're going in person. I mean, this is a whole different ballgame. And so we had masks required all last year in person, and we did it. Okay. So it's a way to step into a better situation. However, I think two of the parents mentioned, can it be more, I would call it situational masking. And I talked to one of the parents out in the hall during the break, and I said, I've looked at that. That was something we were playing around with. Am I today ready to, based on the numbers going the way they are, ready to advocate for situational masking? No, but it's something I would love to talk with our staff about, talk with parents about, and see if we couldn't create a structure that when I was on the break, I took my mask off for a second, I kind of put it on my wrist and I walked and did something. Could we have situational masking? Yeah, that's a thing. There are some school districts doing that. I wouldn't advocate for doing that on day one. Let's start a little more cautious and then ease into those kind of practices. Everything we're talking about is malleable. We really want to find out what works best. So yes, I think your question was, have we looked at other options? Not only have we looked at those, but we're open to them. We're just trying to figure out the best way to start, not to do the whole school year.
Can I just, I first want to say a couple things and then I have a couple questions. So this is my 9th year for serving on D92. I was actually asked to extend for these 2 years because there was no one else. So what I would ask all of these parents, because I think
every voice is important. I'd love to see you all on the ballot the next time around. This has been the absolute hardest year as a school board member. Keep in mind, we do not get paid. And the time that we spend here is only a fraction of the time that we put in. The things that I see on social media, there were quite a few parents that talked about bullying. As adults, bullying school board members because they didn't like how we voted. I encourage you to then get your name on the ballot. It is an incredibly hard position to be in. I am a parent. I am a healthcare professional. Every time I walk into the hospital, I take a deep breath and I put on my mask. I have to wear my mask 24/7 at the hospital. It isn't easy. And I think as parents, we parent, and I recognize and appreciate and respect every parent's decision on what they do for their children. I would just ask you, all of you, depending on how we all vote, and that is to put yourself in our shoes. And this is not an easy decision. And I've seen a couple people that haven't spoke up but kept shaking their head. Get yourself on the ballot. And I would love to talk to you after you do a few months and see that it is not an easy position. So questions that I have, I know we talked about the situational, mask, Dr. Arnold. So students at their desk, teachers, up at front teaching. I think you just said you're right now not at the position to entertain that.
I wouldn't say I wouldn't entertain it. I think it's a tough thing to start the year off with. But I don't want to take that off the table at some point.
Because I think, as adults, masks are difficult, and, everything is changing. What we knew last week or thought we were going to, be talking about tonight, has changed. So I think from what I would like to see is that we really, really, I think, need to look at the situational, masks and no masks. And I think the last thing, if you can maybe just explain a little bit is, and I think one parent brought it up, is more of the kind of the liability of, and I think there was, the one gentleman was asking about, the private diocese versus the public institution, and, what we need to do as an entity, being a public institution.
Sure.
Would you be able to talk a little bit on that?
Sure. Governing bodies, Board of Education, other governing bodies have tort immunity. And so that it's pretty broad protection. As long as the decisions are made in some way that's logical, grounded in good thought processes, you're in a good spot if you were to be sued for things like that. All public schools have insurance carriers, and you have insurance for your vehicles, for the schools, for the buildings, and then also different liabilities, just like a lot of us do on our homes. When it's, if someone were to sue the district for something and said, you didn't put good safeguards in place for snow removal or ice, we'd have to show why we did. this is no different. It's just to just make a decision. The guidance came out and it said recommended, not required. And we said, sure, go for it. Get rid of all the mitigation efforts and just plow it forward. That's a pretty, I don't know districts that have gone that far, just get rid of everything, let's go. But that would be an example of really risky, your insurance carrier would have a problem with that. The insurance carriers don't tell us what to do. They don't make our decisions for us. But what they say is these recommendations are we support, and you should have these things in place in order to feel like you have mitigated your risk, your liability to the greatest extent possible. So I think the decisions we're talking about tonight don't put us in a bad spot. It's the boards that don't put a lot of time and thought into this. We have. We were to the point where we wanted to meet last week and we delayed it a week to just refine our plans a little more. So I don't go to bed at night worried about our liability with really either option we've kind of tossed around. We really are talking about how do we start the year. But I don't know if I explained the liability piece enough.
Yeah, no.
Now, the
mean,
Catholic school, I didn't approach that
right.
either.
I think I'm just trying to kind of think about, questions that were
Sure.
asked, by some of our.
I can talk about that. No, we don't directly plan with the school that he mentioned. We do some things on a limited basis during COVID. Clearly, parochial schools or private schools, not just religious, haven't been under the same guidelines necessarily. It's their choice. Some, whether it's a diocese or some organization that runs the schools, makes the decisions for them about are they going to follow guidance or not, in person, whatever. Last year. From a curriculum standpoint, that's probably a better topic for a different meeting. I can't speak to their curriculum and why they do what they do, but know that the point of being a private school is that they aren't beholden to the Illinois learning standards or other things like that. They can teach whatever they choose to teach. And I don't agree or disagree with that. It's just different.
Right. Okay.
I have a couple questions. One, how does this affect the OASIS program? I'm assuming they'd have to follow the same guidelines. And two, maybe three, would we use the same mask, like mask breaking and all of those policies that we used in the spring, so that the kids got masks breaks at certain times, or if they could go outside and read books and they go outside and read books, that type of thing?
Good questions. For OASIS, our after-school program, for those who don't know, we don't run the program, but we'd expect them to follow those same measures. But it kind of goes with my answer to your second question is, that's where I would look very hard at situational masking. Clearly at OASIS, there's fewer students in a bigger space. They can spread out. And outdoors, you don't have to wear masks. So we would want to be as lenient as possible for the end of the day. We understand it's different, but that does go back to what you said, asked about the mask breaks. We didn't mandate those last year. We left that to teachers to kind of read their class and take mask breaks when they wanted to. I think there's a really important conversation there about how do we loosen that up even more this year. One thing we had to talk about in the past month is, do we bring carpets back into the room? So anybody who's been in kindergarten, first, second grade, a lot of work gets done on a carpet. It's some of the best stuff. They do their morning routine, things like that right there. We weren't able to do that. Like someone mentioned last year, it was sad. If you're used to loving school, you sit in a classroom 6 feet apart and it's a bunch. Now, I will tell you, being in those classrooms, the kids did have fun. It doesn't mean it was as good as it could have been, but kids laughed, kids smiled, and kids learned. We can do more and better, but it was the right thing to do last year. And keeping a 3-foot distance this year makes a lot of sense. I don't know that we're ready once again on day one to put those carpets back in and have 18 kids on a little rectangle carpet doing their morning meeting. But that's the kind of stuff that we do very much want to get to sooner than later. So I think some of that is working with, let's see what our numbers show. Let's see what the teachers are seeing in the classroom. And if they can, I could envision a time when we were talking about the situational masking earlier, that's where that goes. Like if I'm at my desk and I'm 3 feet away, could there be a time when I take off my mask and do my work? I think it's possible. It's early in the process to go there. That's a pretty big leap. That's why we're talking about being progressive and doing this a little bit more slowly than that. I think it's a leap to go from all mask last year to do it whenever you want this year. But anything's possible. We can make these things work. I'm going to come back to keeping those things on the table and putting those in place when we're in the blue. When we're not in the blue, I wouldn't advocate for that. My problem is I don't know where we are today. All I have is community metrics. I don't have our school metrics. That's the dilemma that we have. How do we start? Did I answer both of the questions?
Yes, and I thought of something else
Go
while
for
we
it.
were talking. Quarantining. I know we had discussed about how teachers would handle quarantined students. Can you elaborate a little bit more?
Sure, that was an agreement we worked out with the union.
Yep.
And that would look more like what it has traditionally looked when a student's out sick. In the past, prior to COVID, if a student was out sick, you got your homework assignments at the end of the day, you picked up what the day's work was, and that was that. That's the minimum we expect of teachers. We know that our teachers have the capability of doing some lesson videos. Some of them may do some intermittent live streaming where the kid could get on, see a lesson and get off. We aren't requiring any of that, but we're giving teachers menus of options to choose from. But at minimum, it would be no different than what's always been the case. If you're out 10 days with chickenpox or something like that, you would just get the assignments at home and keep up. And, I think most teachers realize the more they help the student, it's all about continuity of learning. That's what we said from the beginning. And so the more we can bridge that quarantine time, the better when they return.
Can I just ask one more
You
question?
can ask all the questions you want.
It's our meeting.
I mean, what is today? August 3rd. First day back is the 18th. Okay. So do we have to make a decision tonight?
No. I'm just being, no, it's the thing that's, I received some emails from a couple parents, like very frustrated that we weren't already making a decision last week, right? 2 weeks ago. And my take on that continues to be, this is something we don't have to make tomorrow. Last year, we were making decisions on how we're going to educate kids in person, remote, and all that. It affected people's jobs. It affected their daycare. It was tough. Those are really tough decisions. Timeliness was very important with that. Sure. You don't have the same. It's flipping a switch is what it really is. There's no pre-planning that has to go into this. We could be ready tomorrow with either decision. We don't have to do that today. I know a lot of people would like decisions. People like a stake in the ground. Here's how we're doing it. So I'm not advocating either way, but the direct answer is no.
Okay. So do we talk about that?
Yeah,
this is
so my pause was just me thinking that through and hearing Dr. Arnold's response, because last year, nearly the same day, right? Probably one day late, whatever. First Tuesday in August, we were here doing similar work. Honestly, more difficult because we were talking about in-person versus fully remote, and giving staff, which was the biggest, families and staff, from a learning, my brain went to the learning piece and the teaching piece, but families and having to have their students at home and all of that. And so it was really important that we give people a place to be and know where they were. If we do this in a week or 2 weeks, 2 weeks is the start of school. It's probably a bad idea. We would have to do it.
Our regular board meeting is on the 17th.
Yeah.
That's the day before.
Day before, and that's a bad idea.
It's up to you guys.
Right. I mean,
I think we've heard public comments. We've had a good, conversation about it. Everything is sort of live in front of us right now. I think it's probably best to make some level of decision tonight. I mean,
Okay.
everything can change if new data comes out or something catastrophic happens, good, bad, or otherwise, we can always change the decision. But, you know, my position is that, you know, the resolution that we have is well thought out. It's obviously in the kids' best interest. And as I walked in here, I kind of expected to support it for the most part, and I still do quite a bit of it. I think where I'm, after hearing some of the public comments and thinking through it and thinking about my own house, how we're kind of dealing with this, and recognizing your very good point that our district data is the most important data that we have, right? Right now we're looking at countywide and kind of zip code wide, which isn't perfect. And it's our students that we're most concerned about, not necessarily their grandma or their next door neighbor. It's our students that we have to be concerned about. And that's going to be very different numbers. I'm leaning towards the idea of starting, you know, mask recommended. So obviously we want to support anybody who wants to wear one, teachers and students alike, but watch where our data goes over the course of 2 to 3 weeks. And if we recognize that it's, you know, it's substantial and it's a problem, we want to empower you to have that option to, you know, to make the mask required so that we can get those numbers back in shape. That's just kind of where my head is right now.
I would say my head's probably in the other position. Having been an educator for my entire life, 22 years now, and as a professional educator, I've always found that by coming in with the most stringent and established guidelines to be able to remove and release and loosen has always been a more successful approach. Whether it be in a classroom teaching kids or working through as a counselor, a coach, you know, you set the tone and you can always make adjustments that will relieve some pressure and move forward from there. Has always worked better than to give a lot and then try to pull it back. You know, I think it's really hard that if I allow, you know, a cell phone to be out in the classroom and while I'm instructing, and then I realize 3 weeks into it that this didn't work out so good and I should have had these put away, pulling those back in doesn't work as well. And that's a really tough spot, I think, to put our teachers in, to say, hey, we're going to give you the option. And then after our first 2 weeks of data, and if something was to come out where we were in a bad spot, yeah, we were wrong, put it on. I would much rather be able to, you know, eat it for 2 weeks and say, this is tough, but we are committed that every opportunity that we have to give our students the option to get out of that, that we could do it. And I feel better about that piece. I think from an educational standpoint, that's the best way to go. So that would be my feeling. I think we all, I mean, if this board hasn't demonstrated that we want the best for the kids, we fought like heck to get the kids in the building last year. We wanted them here. Our administration worked their tails off to prepare buildings, to get things to a point where our kids could sit in the building and learn from their teachers. We're committed to what, as a whole district, we feel is best for the kids. I don't know. I have faith in what we've been doing. So that'd be my position. I also would agree. I think we've heard from everybody tonight. We need to make a decision tonight, because then we're just pushing the can down the road another 2 weeks. Let's let the data speak and work from there.
Okay. Doreen, Melissa, we're good?
I'm good.
Okay. So just to follow up, Grant, I think that, right, and I think this is a good example, this discussion is a good example of how school boards are meant to work and how these meetings, for a lot of people who are attending meetings for the first time and stuff, that we exchange ideas, we have ideas in the moment of the meeting, we think about them before, we think about them during, and go ahead and make decisions based on those things. So The recommendation as it stands is to start school with masks. Yes,
Universal masking.
Universal masking
And the shield testing.
and the shield testing are the two big pieces of the plan that we're approving tonight. So I just want to make that clear to the board as we vote, so everybody knows what we're voting on.
And then just the notion that we're going into this with 2 weeks, 3 weeks.
September 8th would be the first
Okay.
check.
Yep.
Probably worth, and I don't want to go fast on this by any stretch. You know, obviously most of that first page of the resolution are all your legal whereases. So it's just more historical and building the case. The things that this is really putting forward, number 2 talks about universal masking. Number 3 is the shield saliva testing. Number 4 talks about gradually removing, and this is what you're talking about, Matt, gradually remove any COVID-19 mitigation measures previously in place while continuing to monitor COVID-19 transmission rates in the schools and or community. 5 is reinstating, so this is going the other way, reinstating any COVID mitigation measures that have been removed, including mandatory masks, in the event determines that health and well-being of staff, and that would obviously be based on the chart. It's not something I'm just going to make up. But that's number 6 was just the bottom line, that if the state overrules us and goes all in mass, that we do that. But
I just
don't
wanted
know
it
that they're going that way.
reiterated. Yeah.
So that, but yeah, I just want to be clear on what.
Yeah, exactly.
Right.
And then, you know what, if I can just ask for the August 17th meeting, can we have this, like we revisit this? And, you know, let's just see where we're at.
Okay. Do you want to add that as some kind of an action item or discussion? And that could be something you could talk about later.
We can talk about it as
But
we build
at
the
minimum,
agenda.
revisit the topic or
Right.
just check in.
Mhm.
Okay. There will be more to share because, like I said, I can't say enough. It sounds like I've heard words flip-flop and that kind of stuff. I don't hear things flip-flopping, but literally every day it seems like there's a new piece of guidance that comes out that we have to think, how do we apply this? So by the 17th, and this dashboard that we should be finding out about Friday, by the 17th, I'd expect to have that clear exclusionary guidance, that kind of hard to read chart that we're used to, updated from IDPH. So I expect a lot more information between now and then. And obviously we'd know more about zip code data and things like that too. And I would commit, obviously before school starts, having very clear, publicly visible, that those metrics that we're looking to use to play into that. It's still a little wiggly right now, but I stand behind that colored chart that we presented. That's the best framework we have at this point.
Yeah, Dr. Arnold, on that point, I wondered if we could or should codify those numbers in the resolution, just so that they're, I know that it sounds like they're a little wiggly right now, you know, but the 0 to 5, 5 to 7.9, whatever, you know, and escalating from there. Should we codify that in the resolution? Because we just point to metrics and it's a little squishy.
Can we amend the resolution once we have the metrics established?
You're the board, you can do whatever you like.
I think that's a good idea.
But is that something we do on the 17th?
That might be the action item,
Right.
to formally
Yeah.
approve the metrics on that. Okay.
Yep.
Yeah.
Sure.
I just don't think we have the enough to put it in.
I wouldn't want to commit to it today, but by the
Right.
17th, school starting, we'll be ready.
Right. Okay.
So you have you have references to metrics in here, which is guiding our decisions, and that's good enough to get us to the 17th before students come to solidify that. Okay.
All right. Anything else? Okay. Roll call, please.
Middleton,
Yes.
Gurecki, Zapke,
Yes.
Washington, Spice,
Yes.
Nicola,
Yes.
Westerhout.
Yes, motion carries. All right, at this point, we have public comments and items not on the agenda. A designated portion of the board meeting is set aside to hear comments on topics listed on the agenda, not listed on the agenda. A person wishing to speak must sign in, provide all information requested on the sign-in sheet, including the topic they will be addressing. The board president will call speakers up by name, announcing their time to comment. A time limit of 5 minutes per speaker per agenda topic will be imposed. The purpose of requesting such information on the sign-in sheet is to obtain the correct spelling of the name of the speaker and contact information, which may be used for any necessary board follow-up. We had 2 people wanting to speak on sorry, that's the wrong file. I did have 2 people who asked to speak on non-agenda topics. Michael Dean.
Yeah, my name is Mike Dean, and I listened to what you said here. So that's, you took care of that. And we'll find out August 17th. I might not agree with it, but the one thing I want to bring up, the lady said that she been here for 9 years. And a lot of people don't know what's going on in these school systems. What's being taught. I like to see cameras in here with the teachers in the rooms so we know what's being taught and what's going on with these masks and what's going on with anything that's being taught in these schools now with the world trade. I mean, when people were coming up here and they were talking about what are we teaching our kids? Are we teaching them history? Do we teach writing in this school? A lot of schools don't teach writing anymore. Why? Do we teach writing in this school? Because I was ashamed when I went to a bowling alley one time and they asked 11-year-olds to sign their name. They couldn't sign it. I was shocked. And they says, yeah, we don't know how to sign our name. We never were taught. Well, what are we doing in these school systems? Dr. Arnold sits up there and talks and says, okay, this is what but it was already told up here by somebody that all this was false. All this numbers were false. He was on the board. So I actually want to see cameras, just like they have with policemen, just like they have with everybody else. I'm going to go around to all the schools. Maybe the parents can get together and find out, because you were talking about you're going to start a new ventilation system in here. And it's going to cost. Well, if that costs, cameras cost, well, let's get the cameras in here. That way the board isn't on, the board isn't tense. You guys are doing it great. You don't get paid. I understand. But like I ran some stuff with the union. I did other stuff. I mean, I helped ball teams out. I didn't complain. I did that for a long time. That's part of the thing of being a parent. It's 110%. It's like you said, if one of the other parents can come up here and run against one of these people, you got that, you can do it. It's we the people, though. It's not we the unions. In the public sector, they probably have about 7-8%. But in the private sector, I just want to let everybody know, in the private sectors, there's only about 6% left in the private sector. And if we go into red, we lose our union. We lose the company. So we have to watch out. Here in the public sector, they get tax money from the federal government. So they have more power. But you being parents and me being a taxpayer, I come out strongly about that. So let's wake up. I liked it, like I said, this is a new agenda. Cameras in the classroom, cameras on the appel. So we want to make sure that if kids running problems in the classroom and the teacher's saying, hey, what's the problem here? You got it on camera. We don't have to deal with it. You just teach history, math, and you teach science, writing, and baseball coach, like you're a baseball coach, football coach, I don't know what you coach, but that's outstanding. But you're getting paid for it. I don't know if you're getting paid for it or not. But I never got paid for anything. Sometimes 4 hours of sleep. Never moaned about it. Who cares? That's in my past. I enjoyed doing it. It's like I said, I gave 110% or 120, and I'm still fighting. I like to be sitting at home right now. Like I said, having a little bonbons and doing nothing. I mean, I'm at that age. But what's going on, what's happening? No. I can't do it. I can't let the bureaucracy of this country take over. And that's what's happening. Where's our taxpayer money going to? These teachers' unions are dictating what we're supposed to do.
30 seconds.
But anyway, thank you very much. And I'd just like to see cameras. That's a new subject. So we can find out what's really going on in these schools. Thank you very much. And I appreciate this opportunity to speak, and to the board members. Thank you very much.
Thank you. And Jenny Lee Gamino.
Okay, so this was my first board meeting, so I didn't understand the agenda and non-agenda items. So my speech was a little wrong here. But I have emailed, I know there was a lot of new bills that were passed in Illinois this year. And so I emailed the board numerous times wanting to know their curriculum, and I got very vague answers. When we were making the decision whether to send, like I said, my kindergartner to Walsh or to keep her in private, I had answers that I wanted. I had questions I wanted answered, and I never got those answered. I wanted to know the curriculum, what is going to be taught to my 5-year-old, what is going to be the reading list. I never got those answers. So the reason that we decided to keep her in private school is that she will not be taught, my children will not be taught that colors matter. And that is exactly what critical race theory does. It's dangerous, and it makes kids assign moral value to people on the basis of their skin color. And I can't say if you guys are teaching that or not, because like I said, I was never given an answer. So if you guys are not teaching critical race theory or sex education, House Bill 0818, I apologize. But like I said, I was never given a clear answer as to what my daughter would be taught. So it's really inconceivable that anyone could look back at history and not see that singling out of a particular racial or ethnic group as the cause of all societal problems can lead us to a very, very bad place. My children will not be taught sex education or any form of it. I've seen some of the curriculum, again, not from the board here, but just the curriculum that will be taught in Illinois, and it's nauseating. It's not education. It's over sexualizing them. It's grooming them, and there's no place in it in the schools. So that, I guess, there needs to be more transparency. Like I said, I sent numerous emails, I think actually directly to you, Dr. Arnold, about the curriculum, just asking for a clear reading list so I know what my 5-year-old is going to be reading, and I couldn't get any of that. And so that needs to change. Thank you. That's it.
Thank you. All right, do you have a motion to adjourn the meeting?
I'll second it.
All those in favor signify by saying aye.
Aye.
Aye. Ayes have it. All right, thank you.
All right, thanks, guys.